Hi everyone, my name is Ross Anderson. I'm one of the urologists at Urology, Nevada, located in Reno, Nevada. Today's video series will discuss male incontinence and the surgical treatment of this condition. We hope that this video series will act as a review of information that we discussed during clinic, or if you're a potential new patient, this can be more information for you to go over prior to the appointment. I also find these videos can be helpful for patients' family members, spouses, partners, anyone who missed the clinic visit but wanted to go over some of the information that we commonly cover. Thank you for your time and attention watching this video, and we look forward to seeing you in clinic. This video focuses on male stress urinary incontinence, and my other video series talks about all different types of incontinence, leakage in women and in men, urge, stress, or mixed incontinence. But here specifically we're talking about male stress incontinence. And I want to be clear what that is: the leakage of urine that happens when the pressure inside the abdomen increases. This is usually movements like bending over, picking up something heavy, or standing up suddenly. Male stress urinary incontinence is a known side effect of the treatment of prostate cancer, both with radiation and with surgery. This is the most common cause of male stress urinary incontinence, and most of the patients that receive surgery for stress urinary incontinence are those that have been treated previously with either radiation, surgery, or a combination of both. Somewhere in the middle of my training, I became really passionate about quality of life surgeries. What I mean by this is quality of life surgeries are those surgeries that can really improve how you live your life day to day. There are lots of surgeries we do that are totally necessary in urology, removing kidney stones to unblock a kidney, for instance, or curing kidney cancer by removing tumors. These are all very necessary surgeries to save someone's life. But what I'm talking about here are the surgeries that really improve the time that you have left during this life. And stress urinary incontinence for a man can be really devastating. This can really create a time in their life that they may not be able to do the things that they want to do. They may avoid certain situations, or they may decrease the amount of fluid that they're drinking so they leak less. This is what I'm talking about. Improving quality of life so you can get back to doing the activities that you want to be doing. Either the male sling or the artificial urinary sphincter that we'll talk about in the next videos here, both can improve quality of life. About 90% of men say that they would do this surgery again and they would recommend it for someone else, meaning that they have seen an increase in their quality of life and they're back to doing what they want to be doing. The main goal of the surgeries that we do for male stress urinary incontinence is to improve the leakage. Note that I didn't say make it perfect or completely dry. This would be an unrealistic expectation, but we do improve your quality of life by giving you more dryness, decreasing the pads or depends, briefs, undergarments that you may be wearing. And it's our goal to get you more dry and get you back to doing the activities that you love doing. Treating male stress urinary incontinence can be non-surgical and surgical. The non-surgical options that we often will explore before doing surgery are things like pelvic floor physical therapy, where a specialized therapist really shows you how to use your pelvic floor muscles to help control the leakage before it happens. Other non-surgical options include external penile clamps, or commonly known as Cunningham clamps, external catheters like condom catheters. As we mentioned before, pelvic floor physical therapy can improve stress incontinence significantly, and urethral bulking agents that are injected within the bladder neck or urethra. Surgical treatment for male stress urinary incontinence comes in two main forms, a urethral sling and an artificial sphincter. They're both surgically implanted, and the urethral sling is really good for mild to moderate stress urinary incontinence and for men that have no history of radiation. Mild to moderate means up to a few pads per day to protect the underwear from urinary incontinence. Any more than that, or if you're using multiple briefs per day, we want to be talking more about the artificial urinary sphincter. The first option for mild to moderate stress incontinence, like I said, is the urethral sling. This is a mesh-based product that helps lift and reposition the urethra and can really improve stress incontinence in men. This is a nice option because there's no moving parts or no pumps to activate or cycle like the urinary sphincter. But again, like I said, it's only for mild to moderate stress urinary incontinence. The artificial urinary sphincter, or AUS, is a product that has been on the market for something like 30 or 40 years. It is the workhorse for treating male stress urinary incontinence. And I'm going to bring up a couple pictures to show you how it works. It's made up of three components. The cuff, or almost like a donut or cushion, goes around the urethra. When it's activated or on, it's inflated and it squeezes the urethra and helps decrease the leakage. When you're ready to urinate, you use the pump that is surgically implanted into the scrotum. It's pretty small and it's really hard to tell that you even have it unless you feel the scrotum. So it's your job when you need to urinate to pump that a few times, which opens up the cuff, and the fluid that was in the cuff goes back out of it and into the small pressure regulating balloon or reservoir that sits behind the pubic bone. After about a minute, it automatically reinflates and then closes down. Once you're done urinating, then it's basically closed off and you go on about your day. The next time you need to urinate, you go through the same process. This video is from Boston Scientific, and it is a cartoon showing exactly what I explained, and the animation is using the pump to cycle the device, open up the cuff, empty the bladder, and then automatically the cuff reinflates with saline, closing off the urethra. If you've made the decision to move forward to surgery, I want to congratulate you. I think you're making a good decision. With either the sling or the sphincter, we should talk a little bit about what the day of surgery looks like, and as well as your follow-up after surgery. So first, with the sling. The sling surgery takes about 1 hour. There's one incision behind the scrotum along the perineal skin, and the surgery itself takes about an hour. You'll go home after you recover and you'll have a Foley catheter or urethral catheter in for about 3 days. You'll come back to our clinic to get the urethral catheter out and make sure you can pee okay. Very rarely we would see a patient that the sling is too tight and it makes it difficult for you to urinate, and we would need to place a catheter back in. Again, this is very rare. After that, we want you to avoid heavy or strenuous lifting for about a month after surgery. This is to allow for the sling to really heal in and stay in place. Now let's talk about the artificial urinary sphincter. The surgery again takes a little over an hour. There's 2 incisions, one behind the scrotum and then one in the groin. You'll have a catheter in just for 1 day, and we have you come back to clinic the following day after surgery to get that catheter out. After that, we leave the cuff deactivated or open, so you will experience the same amount of leakage that you had before the surgery. This is to allow the area to heal before we activate and start using the cuff. That happens at about 4 weeks after surgery. We have you come back to clinic and we activate the device and show you how to use it and make sure you're comfortable with how the pump works and how to use it. Most patients with either surgery take about 2 weeks off of work. We want you not to be doing any heavy lifting or strenuous activity for 4 weeks after surgery at a minimum. We see you at those predetermined days after your surgery in our clinic, as well as postoperatively at about a month to activate the urinary sphincter, or at about 2 weeks to make sure you're peeing okay after the sling procedure. When we're counseling patients about surgery, we have to tell you about some of the side effects or possible complications. That's with any surgery that we do, but there are some that are specific to these two operations. For the sling specifically, about 1 out of 10 men could develop worsening incontinence or leakage of urine. A very small percentage of men would develop infection of the mesh or erosion of the mesh into the urethra. And even more rarely, less than probably 1% of men would have pain related to the mesh, and that would need to be removed. The mesh works really well for many years and can give men a lifelong or even just years of improved continence. But in the event that this does worsen, we would want to see you back so we could assess you and then counsel you about your options of moving forward to an artificial urinary sphincter. With the sphincter, there are 3 moving parts, opening and closing that cuff every day, multiple times a day. So about 5 out of 10 men would need a revision of the device at about 5 years. The majority of men get about 10 years out of a device. And that's a great longevity for this product. I've seen as long as 23 years and as short as a few months if it's not working correctly. But again, the majority of men get many years of improved continence or decreased leakage of urine out of this device. In the event of uncommon things like infection or erosion, that would mean the device would need to be surgically removed. If this does happen, we wait a few months before talking about redoing or reimplanting another device. During that time, your leakage would be back to about the baseline that you had before the surgery. So this message is not to scare you, but we have to tell you about all the things that can happen or could happen in the unlikely event that they do occur, so you can be really well informed. Thank you for your time and attention watching these videos about male stress urinary incontinence and the surgical management. I know it's not everyone's favorite topic, but I'm really passionate about it. I do think that we can improve a man's quality of life if we can get him more dry. Again, we never want to guarantee complete dryness or pad-free life, but we do think we can improve things or make you socially continent. That means getting you back to doing some of the activities that you may have shied away from since developing stress urinary incontinence. We look forward to meeting you or seeing you again at Urology Nevada. Visit our website at urologynevada.com, and thanks again for watching this video series.